Good morning. Thank you all for coming. Since January 12th, the Pan American Health Organization, the Global World Health Organization family, and our partners have been mobilizing resources at all levels to meet the overwhelming challenges of bringing humanitarian relief to Haiti. This past weekend, our director, Dr. Mirta Rosas, traveled to Haiti to observe the relief efforts and assess health needs in person. She visited with Haitians and with representatives of international organizations, the government, Ministry of Health, about the current situation and what needs to be done going forward. At this point in the relief effort, the need for emergency surgical care has substantially declined. We are seeing many fewer traumatic injuries, fractures, wounds, and burns, and internal injuries as well. The pressing needs are clearly now for more post-operative supportive care and follow-up of patients who have already had surgery and basic primary health care services to meet the ongoing health needs. These health needs include the maternity care, post-operative care that I mentioned, chronic health problems including diabetes, heart disease, HIV, and tuberculosis. Haiti's Ministry of Public Health has developed a strategy for meeting these needs, which includes community-based facilities and mobile clinics to provide post-operative and primary care. PAHO, WHO, and other international health partners are supporting the ministry's efforts with this strategy. Brazil, as just one of many examples, is providing $700 million for 10 urgent care units, 50 mobile units for emergency care, a laboratory, and a hospital, among other health services. Part of the shift in focus involves improving logistics for transferring patients and supplies and identifying needs for medicines and equipment. It also requires assessing the emerging needs for healthcare personnel. For example, it is clear now that more nurses, physical therapists, and mental health providers are needed, and fewer medical doctors actually, especially surgeons who were so vitally important during those first days after the quake. Some of the foreign medical teams that are preparing now to go home will need to be replaced. We must ensure that those who replace them have the kinds of healthcare skills that are most in need and align with the current gaps. One of the most urgent needs is the follow-up care for thousands of Haitians who have had amputations. PAHO WHO is working closely with the Handicapped International to develop a plan for healthcare services for the large number of amputees. For amputees, the seriousness of their disabilities over the long term will depend very much on the follow-up care and the quality of that care that they receive now, including physical therapy. Supportive mental health services will also be critically important for their recovery. While disability itself is a hardship, it also brings economic and mental health problems that can seriously impact persons' lives. These types of challenges are even greater in a country like Haiti. Many other potential problems may arise and cause long-term disability unless they receive proper attention, including proper self-care. We know that patients who fail to exercise, injured arms and legs, for example, are likely to lose mobility and the usefulness of their limbs, resulting in more long-term disability. Reestablishing and strengthening primary care services in Haiti remains a top priority with support with this rehabilitation therapy. PAHO is working hard to strengthen surveillance networks to ensure that outbreaks of communicable disease, if they occur, are identified early for rapid control and the saving of lives. We are particularly concerned about waterborne diseases and respiratory illnesses. The earthquake that came crashing down on Haiti paralyzed its immunization program. Diphtheria, virtually eliminated in all other countries of the Western Hemisphere, still sporadically caused outbreaks in Haiti even before the earthquake. So plans for maintaining routine vaccinations with the routine schedule in the reconstructive efforts for primary care are also vital. To that end, it's exciting to announce that the Ministry of Health declared that immunization will resume again next Tuesday with the support of PAHO, WHO, and UNICEF. The first vaccines will be administered, and those will include diphtheria and tetanus, the DPT vaccine, measles, and rubella. In the hundreds of spontaneous settlements where the quake survivors had gathered, measles rubella vaccinations will also be provided through special campaigns in the months to come. This is excellent news because only half the population in Haiti has been immunized against tetanus, for example. Priority groups, in particular children under 5 years of age, will be targeted first. WHO PAHO will continue to maintain its long-term staff and commitment in Haiti, plus an additional team of more than 20 international experts from around the world in coordination, logistics, epidemiology, surveillance, communicable disease control, water, and sanitation. One of the main areas where we've been able to make a substantial difference has been the supplying of the hospitals with medicines for treating the sick and wounded. WHO PAHO runs the PROMES office, which is the national stockpile for medicines and vaccines, a warehouse located in the capital, which luckily at the time of the earthquake was stocked with medicines and supplies such as Band-Aids, plaster for making casts for fractures, gloves, and so on. In the last 11 days, we have provided almost 200 pallets full of medicines to hospitals in the affected areas of Haiti. In all our actions, we're placing high priority on reaching the most vulnerable populations, doing things like talking to mothers of young children about breastfeeding, hygiene, and sanitation. I'm also pleased to announce that starting this week, women in the informal settlements are being trained as breastfeeding counselors. They will identify pregnant and lactating mothers in their areas and support them to continue breastfeeding, which is essential for good health and nutrition of babies and infants, particularly in these emergency settings. This will help prevent future cases of malnourished and undernourished children. I would like to end by saying that reconstruction is on everybody's minds, and rightfully so. Our response to Haiti cannot be an unsustainable, one-off effort. To that end, I just returned from Montreal, where yesterday a ministerial preparatory meeting was held to focus on Haiti's reconstruction. Besides the President of Haiti, high-level representatives from the United Nations agencies, partner countries from around the world, non-governmental agencies, and the Haiti's diaspora pledged to commit themselves to a long-term plan that addresses the following. Haitian government taking the lead for ownership and the development, implementation of a reconstruction plan of action based on the assessment of needs. Coordination among all partners that is well organized and effective. At least a 10-year plan of action grounded in sustainability. This will require a long-term effort. External aid that's effective and built on lessons learned. aid that's inclusive, that involves all other entities such as the diaspora, civil society, non-governmental agencies, and in particular we need to be prepared and ready to support and encourage the Haitian people themselves, what they can do in the reconstruction response and their vital role. It was Secretary Clinton who said yesterday in Montreal that it must be the Haitian people themselves who lift up their country with the support of a well-coordinated effort of partners, sensitive to the fact that when Haiti suffers, we all suffer, and when Haiti thrives, we all thrive. And finally, accountability, so that products are delivered according to achievable milestones. And these will need to be monitored and evaluated every step of the way. I think I'll stop there, and I'm happy to entertain any questions. Thanks again for coming.
Online. One is the first one from Colombia, which asks, what do we know about care for persons with HIV? Are we making efforts to guarantee the continuity of antiretroviral treatment for HIV-positive persons in Haiti?
That's a great question, and we are making efforts, particularly with those mobile teams who are taking with them some of the essential medicines and supplies that will help support people with chronic conditions such as HIV infections. That's also a strategy used in the implementation and support to the clinics that are being built and sustained in the more than 600 resettlement areas. So it is a vital, important strategy.
Okay, thanks. And then the other question is, can you tell us more about the immunization effort and when it will start?
I mentioned that the Ministry of Health just announced that next Tuesday they will begin implementing again their routine immunization program. This is great news. It's difficult to provide such services during the immediate response, those very challenging initial days when buildings and rubble, dead bodies clog the road. So now that this is an important milestone actually in the progress that's been achieved, the fact that routine immunization targeting the vulnerable, especially children less than 5 years of age, will be restarted in next Tuesday.
Okay, and then they're asking a follow-up question. Will this be done in mobile clinics, or will they have it in an immunization building?
We will support the Ministry of Health and its plan to use the existing standing structures that provide primary health care services, as well as the use of mobile teams that the person referred to. So it will be a combination of tactics to reach more effectively vulnerable children that need the protection of immunization. I'd like to say that even before this crisis, before the earthquake, immunization coverage in Haiti tended to be generally low, some of the lowest coverage in the Western Hemisphere. So it's very, very important that we put this as a top priority, because after such disasters, diseases such as measles can emerge, and so we want to be sensitive to that and support the government with their efforts.
Here's one more that came in. There was a report on the BBC that doctors from a local NGO feared cholera in some of the refugee camps. Have we had any reports of cholera outbreaks in Haiti?
We have had no reports to date of any substantial infectious disease outbreaks. Cholera was last reported in the Americas in, I believe, 1991. And in fact, at that time, I was working for PAHO as an epidemiologist on the polio eradication program. And cholera emerged, unfortunately, in Peru and rapidly spread to the rest of the hemisphere, including the United States and Canada. But it was subsequently controlled fairly quickly. It became one of the larger outbreaks that we've ever experienced. But since then, there have been, to my knowledge, no additional cases of reported cholera, including from Haiti. So the waterborne diseases in general is a risk that we're all very concerned about and addressing with the provision of potable water and reconstructing safe water services.